You've probably heard of insomnia, and perhaps you've experienced it at some level. But there's also sleep apnea, narcolepsy, and sleep paralysis. And these are just some of the more common forms of sleep disorders. Some people need less sleep than others, but we all need frequent, if not nightly, periods of complete restful sleep in order to perform our jobs well and keep us from being edgy or grumpy or ill. The causes of sleep disorders can be complicated by psychological or medical conditions, but it also can be a matter of not getting enough exercise into our daily routine. Tonight on Your Health, my guest is Dr. Angelo Illuzzi from Du Bois. He's a pulmonologist and a sleep expert. And also with us is Harry Stoltz, a patient of Dr. Illuzzi's who has experienced very successful treatment for sleep apnea. We'll talk to him about his treatment plan, but we also want to hear from you. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're here to take your phone calls and answer your questions about the importance of maintaining an active lifestyle and the role it plays in determining how well you sleep. Call us at 1-800-543-8242 to join in the discussion. To start things off, I want to just talk to Dr. Illuzzi for a second about sleep. Do we need 8 hours? And if we do, how the heck can we fit it in?
Well, the recommendations now would be to get about 7.5 to 8 hours of sleep at night. On average, about 100 years ago, most Americans got about 9.5 hours worth of sleep at night. And now, as I just reviewed the National Sleep Foundation's Sleep in America poll, it seems like that the amount of time that people are sleeping is actually drifting down to somewhere between 6.5 and 7 hours of sleep at night. And it's true that a lot of patients will need, or a lot of individuals will need, varying amounts of sleep, especially as we, from our youth until we get old. But the recommendation would probably be to be getting about 7.5 to 8 hours of sleep. The invention of the light bulb actually changed everything.
Well, if we don't get 7.5 to 8 hours of sleep, what are the consequences of inadequate sleep?
Well, this chronic sleep deprivation that people experience, and probably most Americans are experiencing chronic sleep deprivation, can lead to anxiety, depression, stress, chronic fatigue, poor work performance, poor quality of life, marital stress, psychological issues, basically because of chronically being tired.
Well, Harry, you're a patient, or were a patient of Dr. Illuzzi's, and
Yes,
you had some sleep issues. What exactly did you realize about your sleep pattern?
Well, my issues first started out, I always thought they were more my wife's issues, because she was always bothering me, saying, you're snoring, I can't sleep at night, you're waking me up. She'd go to another bedroom, and then she'd say, well, I can still hear you snoring at night. And for a long time, I just kind of put it off, and I thought, well, I don't really think I'm the one with the sleep problem. But anyways, she continually, got on me about not, snoring, not taking care of the problem. And we were friends with Dr. Illuzzi and his wife, and so he would put the bug in her ear about how harmful this could be to me. And anyways, she really started worrying when she'd start paying attention at night when I was sleeping, and when I stopped snoring, that's when she really worried more. Because when I stopped snoring, she didn't think I was breathing. So she lined up, she called Dr. Illuzzi's office and made an appointment for me, and she let me know, you have an appointment to go see Dr. Illuzzi. So I was very reluctant to go, and I wasn't very happy about it. But I went, and he lined up an appointment for me to go to sleep lab, which I went there overnight, and they hooked me up to a number of different things. And while I was there, I said to the nurse the next morning, I said, oh, I didn't sleep at all while I was here. And she said, well, you did sleep, but just not soundly. And the testing showed that while I was sleeping, I'd stopped breathing on numerous occasions, an awful lot. As a matter of fact, it was an alarming amount. So that really scared me. And they've fitted me up with a machine that's called a CPAP machine that would help take care of my problem. And immediately from the first night that I used it, I had a fantastic night of sleep. I didn't snore at all, and actually I don't snore at all now. And there has been a few occasions I've been traveling or something, I forgot to take the machine with me, And when that happens, I do not sleep at all. It's just, it's terrible. You know, as far as me going to see Dr. Illuzzi and getting fitted up with a CPAP machine and all, not only has it been a great thing for me, but it really has been a fantastic thing for my wife.
Oh, that's great. Well, maybe some marital stress has been alleviated also. We're going to take a call from Kirsten from Belfast, New York. Hi, Kirsten.
Hi.
Do you have a question for us?
Yes, I work nights. I just wondered what tolls that has on people's body and what advice the doctor has for those of us stuck in the night shift.
Yeah, I knew that would come up, actually, because it's a very common problem. Yes, we have Andrew Carnegie, by the way, to thank for night shift with the invention of the light bulb. Night shift workers actually do suffer from more significant health problems than people who are working day shifts. And it's even worse if you have a variable schedule. I know there are certain corporations that use a variable shift where they actually, you know, shift back and forth between days and nights, and sometimes between 8-hour shifts. But the health effects can be that of chronic sleep deprivation. Also, a lot of times it actually shortens life expectancy if you're a night shift worker. So there are issues in terms of sleep deprivation, poor quality sleep, and shortened lifespan. Specific disease processes, I'm not really sure that any have been linked to night shift work, but what you can do about it is you have to try to establish a standard sleep pattern so that you go to bed at a certain time, you try to wake up at a certain time, try to keep those times constant. You have to eliminate any outside interference with your sleep, so you have to keep your room dark as you can when you're trying to sleep during the day. You should take out any distractors, so the television shouldn't be on, the phone should be disconnected, the radio should be off. If necessary, you should even wear eye shades. Try to avoid stimulants just before going to bed at night. I know I see a lot of people in the hospital, obviously, who work night shifts and are drinking coffee just before they go home. You should avoid caffeine several hours prior to going home to go to sleep. You should try to obviously avoid bright sunlight in the morning, so I usually recommend that people, if they're driving home in the daytime after their shift, that they wear sunglasses so as to minimize the exposure to light that they get in the early morning, which would trigger a chemical response in the brain that would keep you from going to sleep. So those are some of the things that you can do to try to get a better day's sleep if you're working nights. Obviously, family pressures play a role. During the weekends, your family wants you there and they want you to be with them during the day. So it is definitely very difficult and a very difficult problem to deal with. You might find some resources on the web if you have web access through the National Sleep Foundation. I know they should have some resources there for you to try to improve the sleep quality and try to get as good a night's sleep as you can, or as good a day's sleep as you can.
Mm-hmm. You know, someone like Kirsten coming home from a shift work, would it be typical that someone might eat food, and then how does eating
yeah, you
affect?
shouldn't really have a large meal prior to going to bed. So your meal during your shift should be sometime before midnight if you're working, let's say, an 11 to 7 shift. And again, no caffeine after 12 midnight for sure. And actually, it's not a bad idea either to start dimming the lights as the shift is coming to an end.
Okay. Well, we're going to take a call from George in State College. Hi, George.
Hi. I have, I guess, 3 questions.
Okay.
I was at a sleep lab a few months ago, but I only slept for about 4 hours, so I'm wondering about the validity of the results. They said I had some apnea, but not enough to do anything about. So I'm wondering whether that CPAD or PAC, whatever it was, would help me. On top of that, I was told that my REM sleep was just 6%, and normal, I forget where they said it's 12% or 17%. Is there anything I can do about that?
Usually we like to get about 6 hours of sleep time in the laboratory. As a matter of fact, a lot of the times most insurance companies will insist on 6 hours worth of sleep. So it may have affected the validity of your test if let's say you did not get it, or you said you only had 6% of REM sleep, a lot of the times REM sleep will predispose you to apnea, and there are some individuals who have purely REM-related apnea, and if you did not get a lot of REM sleep, it may not be truly reflective of what's going on your typical night of sleep. Now, unfortunately, it's hard to perform multiple tests on a single individual because of scheduling problems, the demand placed on these laboratories, because there is a very high demand at this point in time. And so there may be an issue. You almost have to go by the history in this case, or even consider a repeat study. Now, Will, it's hard for me to say whether a CPAP machine would help you, not knowing your complete history and not obviously having access to your study to determine whether or not there were any issues there. But it may be of some value in considering a repeat study if that can be performed to see if indeed it can be excluded or included as the diagnosis.
Okay. Let's take a call from Alice in Huntington. Hi, Alice. How are you?
I'm fine, thank you.
Do you have a question?
Yes, I do. It's brief. For Dr. Illuzzi.
Okay.
His recommendation is for 7.5 to 8 hours of sleep, and I'm wondering if that all has to be at one time, or if you can get that in bunches in a 24-hour period.
Well, actually, that's a very good question, because the old theory of Da Vinci, where he slept for 15 minutes at a time, but he slept several times a day. Actually, sleep works best if it is consolidated. So, because there is an architecture to sleep, everybody goes through various stages of sleep. Now, when you're younger, you tend to get a lot of what we call slow wave sleep, which is very, very deep sleep, and that's the sleep that restores your body. Unfortunately, that tends to dissipate as you get older. The amount of REM sleep you get, which is usually somewhere between 20 and 24% of the night, does not change as you get older. But there is an architecture to it, and it all involves time, and you tend to get most of your slow wave sleep in the first part of the night, whereas you tend to get most of your REM sleep in the second part of the night. So the answer is you're best off getting your sleep in one block, as opposed to trying to get 3 hours here and another 3 hours there and another hour there, because you will not go through the stages of sleep that you should be going through in their proper order or in their architectural design, which would provide the most restful sleep, and therefore the most sense of wakefulness and alertness afterward.
Okay. In case you're just turning in, this is Your Health, and we're hoping you'll join the discussion. I'm Chris Clark, Director of Sports Nutrition, and we'd be really happy to take your calls. I have with me Dr. Angelo Illuzzi from Du Bois. He's a pulmonologist and also a sleep expert. And my second guest is Harry Stoltz, who has been successfully treated for sleep apnea. We're talking about exercise, weight control, and sleep disorders. Call us with your questions at 1-800-543-8242. Now, I'm just wondering, if I go to sleep at night, what is this REM sleep? When does it happen, and how do I know I'm in it? Well,
it's hard to know that you're in it. It actually occurs usually in cycles. Anywhere from every 60 to 90 minutes, you will cycle into REM. And the term REM, which is REM, stands for rapid eye movement. And we determine that by the use of electrodes on the eye muscles, which is what Harry was saying before about how he got hooked up with a lot of equipment. And it's really your dream sleep. And it's not quite clear what REM does for you, but what happens during REM is your body actually undergoes a physiologic state of paralysis. And the reason for that is because we don't want to be acting out our dreams, which is actually a sleep disorder that we see. And so our body actually becomes paralyzed during REM sleep, and that's what predisposes people to more apneas during REM. The REM periods tend to get longer as the night goes on, so you may have a 30-minute period followed by a 45-minute period followed by an hour period. And an interesting phenomenon occurs in patients with sleep apnea is because their apneas tend to get worse during REM, you might see much less REM sleep in sleep apneic patients. And in the laboratory, when we get them started on their CPAP machine, we'll see something called REM rebound, where they'll have 2-3 hours worth of REM, maybe half the night. So the brain is actually catching up on REM sleep. So we know that your brain needs REM sleep, but its specific function is not clear.
Okay. Well, Harry, I was just wondering, you said you were really reluctant to make an appointment to go see Dr. Illuzzi, yet did you think that you were not breathing at times while you were sleeping? Did it ever wake you up?
Well, actually, after it started getting worse, I would catch myself. I'd feel like I was sound asleep, and I'd just like kind of jump and wake up, and I thought it was actually the snoring that was waking me up. After the testing and all, though, I truly think what was happening is I would stop breathing. And during the testing, they found out, I mean, there were periods of time that I'd stop breathing for up to 30 seconds at a time.
Is that significantly bad?
Yes. I've had people who would stop breathing for a minute and a half, but 30 seconds is pretty long apnea. Because if you tried to hold your breath for 30 seconds, you'd find out you might have a hard time doing it consciously.
Okay. Well, let's take a call from Nick in Reynoldsville. Hi, Nick.
Hey.
Do you have a question for us?
Yes, ma'am. I was wondering, I have a problem with getting sleep. Like, I try to go to bed around about 10 o'clock, 11, and I can't really, go to sleep. I always, try my best to go to sleep, and I was wondering what could I do to help me get a better good night rest.
Well, it sounds like you have what is called sleep onset insomnia. Do you have trouble staying asleep once you do fall asleep?
Well, once I do go to sleep, it's like I'll either hear something or sometimes I'll just wake up and feel like I'm catching my breath.
Okay.
And I end up waking up real easily like I ain't even been asleep.
Do you know if you snore?
No, sir.
Okay. You're not sure if you snore or you don't snore?
I don't believe I snore.
Okay. Well, you have a very common problem, and insomnia is a very broad subject, and a lot of times it requires us to get a full sleep history from you, but it may have to do with the amount of caffeine you take in, if you take in caffeine late in the evening, if you consume a lot of caffeine, and caffeine is present in a lot of beverages. It may have to do with physical inactivity if you're not getting adequate exercise. There are psychological issues that can be involved. Do you ruminate a lot at night? Do you bring a lot of your problems with you to bed at night? Do you during the night when you get up, do you do a lot of clock watching? These are all problems that individuals can have, and you almost have to train yourself to learn how to get a good night's sleep. So, but some of the basics that I would recommend would be try to set a regular bedtime, try to set a regular wake-up time. Don't lay in bed if you can't fall asleep, because then you develop a little psychological battle with your bed at night. Yeah. Where the bed becomes not a place of rest, but more or less a place of torturing yourself. We usually recommend at least 30 minutes of exercise a day. Do not do that in the evening, because that can cause a lot of stimulation. If you do have problems where you bring all of your problems to bed with you at night, we usually recommend that you create a worry book, which is something like a diary that you would keep all of your problems. I usually tell people, list all of your problems on one side of the page and list the solutions on the other side of the page. Close the book just before you're ready to go to bed at night, and don't take it with you. And know that your problems are there. They're not going to run away. They're not going to go anywhere, but you don't have to carry them with you to the bedroom. We usually recommend either a hot bath or a hot shower about 2 hours before you go to bed, because that allows for a drop in body temperature, which is how most people will fall asleep. You tend to fall asleep when your body temperature drops, and so you will cool off after you take a hot bath or shower about 2 hours before you go to sleep. And and don't eat 2 or 3 hours before you go to bed. And these things would be helpful in trying to promote a good night's sleep. And that's what we call basic sleep hygiene. Okay. If you clock watch, turn the clock around.
Yeah, that's great. Well, let's take a call from Jack in Wilcox. Hi, Jack. How are you tonight?
I'm fine. I just wanted to say that your guest on the panel is me 100%. I suffered from SRS, sore rib syndrome.
From like a wife to...
When this
was your wife doing this to you?
Yes.
Poking you in the ribs?
But what I thought it was, until the doctor sent me for the testing, I am on quite a bit of medication for blood pressure and sugar. And I thought this was causing my tiredness. I didn't feel like doing nothing all day. I went on the machine, and within 1 week, I was back to my normal self. So all I have to say is anybody thinking about this, go get tested. It's unreal what these machines can do for your life. Thank you.
That's a great testimony. Thanks a lot, Jack. Now, let's take a call from Heather in Hooversville. Hi, Heather.
Hi.
How are you?
I'm good, thanks.
Great.
This is a question for the doctor. My husband noticed I was snoring really bad, and I went for the sleep study test, and they had said that I had problems, and that they suggested the machine for me, which I have not gotten yet. I just embarrassed of it or whatever, but the question I have is, does it have to do with weight gain? Because I have gained a lot of weight, and I'm tired all the time. And I was just wondering, no one's ever answered that question for me about weight gain.
Okay. Well, yeah, one of the predisposing factors for obstructive sleep apnea is obesity and being overweight. And so the answer to your question is yes, weight gain will worsen the problem. You may convert what is benign snoring into overt obstructive sleep apnea if you gain significant amounts of weight. Usually the cutoff we use is a body mass index of around 30. So obviously weight gain can make it worse. If you lose weight, it may improve the problem, but there are other issues besides just weight that may predispose you to sleep apnea, so that losing weight may not completely resolve the problem. Again, it would depend on the individual and your physical exam and your individual history to help make that determination.
Okay.
Does exercise help?
Exercise never hurts.
Okay.
I tell everybody, exercise never hurts, and it doesn't. I mean, I see people every day, and getting them to do 30. I'm a big proponent of 30 minutes of exercise, at least a day. Most women, middle-aged women, probably require about 45 minutes of exercise a day, just to maintain fitness. And if you want to train, you need about an hour. You can break it up into 15-minute sessions or 10-minute sessions, however you want to do it during the course of the day, but it never hurts.
Okay. Harry, you're engaging in a physical activity program, is that right?
Yes, I am.
What do you do?
Well, fortunately in Du Bois we have a very nice YMCA, so I try to go there about 5 times a week.
And what actually are you doing when you go there?
Well, I'm mainly aerobic exercise. I like using a stair climber and using the exercise bikes there. And then as we turn into nicer weather, I like riding a mountain bike also.
Fantastic.
So I try to get in at least 5 days a week.
Good job. And you've lost some weight, is that correct?
I have lost some, but I still have a long ways to go.
But didn't you tell me you've lost about 20 pounds?
Yes, I have.
That is terrific, and I congratulate you on that effort. So let's take a call from Paul in Tyrone. Hi, Paul.
Hello.
How are you?
I'm fine.
Good.
I've always been a night owl for years. I mean, I'm going to bed when other people are getting up. Working last trick was no problem. But I read where for jet lag you can use lights and time to change that cycle. But I've never been able to find out how much light or when you can do that.
Yeah, the term night owl actually is a lay term for what we would call delayed sleep phase disorder syndrome. It's a circadian rhythm problem,
right,
where your clock is sort of delayed within the 24-hour cycle.
Yeah, at 10 o'clock at night, I'm going full steam.
You're going full steam, and then you're ready to go to bed about 4 o'clock in the morning.
Right.
How long has it been like that?
About 40 years.
Okay. It's going to be very hard to sort of change that. Actually, interestingly enough, how old are you?
72.
Okay, that's very interesting. Elderly individuals tend to develop what's called advanced sleep phase disorder syndrome, where they're going to bed early and they're waking up at 2 or 3 in the morning, and then they feel like they're insomniac. It's rather unusual for it to last that long. A lot of teenagers have this as a normal process of the teenage years, and then you become an adult, you tend to cycle back into a normal sleep pattern. You can use light, bright lights in the morning, early in the morning, dim lights in the evening. You need, light is determined in a scale of lux, and you need about 5,000 lux worth of light. So these require some special lights in order for it to be used as a therapy. Barring that, bright sunlight first thing in the morning is beneficial. I don't know how successful you're going to be, considering the fact that you've been like this for 40 years. And certainly you could try, but it would involve advancing your bedtime in progressive scale by 15 or 20-minute intervals, so that you're going to bed earlier for several days at a time, and trying to wake up earlier for several days at a time, and slowly progressing your clock backward. And at the same time, again, using dim light in the evening and very bright light in the morning upon first awakening. I would probably avoid pharmaceutical agents. I don't think I would use sleep agents in someone like you. They're very unlikely to be effective or successful. But you have a problem that's extremely difficult.
Okay.
Because even if you do correct it, you oftentimes tend to slip back into the original clock frame.
Okay. Well, let's hear from our Tress in Johnstown. Did I pronounce your name right?
It's Archery.
Archeries, I'm sorry. It's a great name.
Thank you.
What can we help you with?
My dad, he has sleep apnea, and whenever he sleeps, I mean, he literally is sitting up, but he still snores. And sometimes my mom has to push him because he stops breathing for a long period of time. And whenever the young man was talking about how he has it too, it struck something. I wanted to know, is there a surgery, you do something up in your nose or somewhere, you know what I mean, to make the breathing accurate?
There is surgical procedures that can be performed to correct upper airway features that may predispose you to sleep apnea. Again, without doing a physical examination, it's hard to say whether it would work in a certain individual. The gold standard of treatment remains CPAP. That's what Harry uses, which is a machine that's kept at the bedside. It's a computerized air compressor, literally connected by a hose to the patient, who wears a mask, usually over their nose, sometimes over their nose and mouth. And it pressurizes the upper airway and eliminates the obstruction. Now, that being said, surgery is an alternative for some individuals, people who have very large tonsils, people who have craniofacial problems, such as a jaw that's set backwards, or midfacial abnormalities that might predispose one to apnea. But I usually, and I do have people who undergo surgery. The only curative surgery, if somebody is really bad, is a tracheostomy, because that eliminates the upper airway completely. There are other surgeries that are done, such as uvular-palatal pharyngoplasty, where they clean out a lot of the tissue in the posterior pharynx. If somebody has severe nasal obstruction, that would also help, but would probably not correct the problem totally. And they do other types of procedures, which are sometimes very, very intricate and involved, and require a lot of extensive facial reconstruction. So usually we tend to rely on CPAP as an initial measure. If someone's totally intolerant, then we would opt for surgical treatment.
Okay. If you're just joining us, this is Your Health, and we're inviting your calls. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're talking to Dr. Angelo Illuzzi from Du Bois. He's a pulmonologist from Du Bois who's also a sleep expert. And my second guest is Harry Stoltz, who has been successfully treated for sleep apnea. We're talking about exercise, weight control, and sleep disorders. Call us with your questions at 1-800-543-8242. Now, I just want to, we've been talking about this machine that Harry uses to take away any risk of lack of breathing while he's sleeping. Harry, tell me, was this a scary machine, and what exactly, describe it to the best of your ability. Okay. What does this machine feel like, look like, sound like?
Actually, it isn't scary at all. I think some people might feel a little awkward at first using it, but with myself, the first night that I used it, my wife and I were traveling. I actually used it in a hotel room, which typically in a hotel I don't sleep that well. But I used the machine and I slept solid the whole night. I never once got up. and my wife slept all night, so she was just absolutely thrilled about it. But as far as the machine itself, when it's running, it's just like it's a humming sound, which actually I think some people could find kind of soothing. It's almost like having a sleep machine beside your bed. It's just a steady hum all the time.
Is something over your face? Like, is it over your nose and your mouth?
The machine that I have is set up with, it's just a triangular shape that goes over your nose, and there's 2 straps that go around your head that hold it in place.
Is it uncomfortable?
When I first got it, the first couple nights I slept great because I think I was just so deprived of sleep that I needed to catch up, and it didn't matter what was going on. That and from the moment I put it on, I haven't snored since. After a few nights, there's times like I'd wake up that I'd pulled it off in my sleep, but it'd wake me up immediately. And my wife would poke me and say, "You're snoring again." I'd put it back on, and everything was fine. But now, I mean, I can roll over in bed, and it doesn't. The hose is on a swivel. It really works very well. The benefits far outweigh any of the inconveniences. I mean, I can get a solid night's sleep now, which before I never could. And now, if I would go somewhere and I do not have the machine with me, if I forget to take it, I'll wake up in the morning, I'll have a sore throat because I'm breathing through my mouth again, which using the machine, you breathe through your nose, and that completely eliminates the snoring.
Okay. Now, to get one of these machines, this is not like you can go to a retail outlet and buy this machine. You have to go through a specialist.
Right. Obviously, before you would get such a machine, you would have to have a polysomnogram performed. That's still the gold standard that we use to make a diagnosis of sleep apnea. Once we do establish a diagnosis, it usually requires a second night in the laboratory, because everyone is an individual and everybody requires an individualized pressure. Literally, while you're asleep, they fit you for a mask, they introduce you for a mask, they will let you know what it feels like before, obviously, you go to sleep. And a technician is in the laboratory, not in the same room, but in a control room usually. And she is, or he is, adjusting the pressure, watching watching the monitoring equipment, knowing whenever you're having an apnea. They will make adjustments in the pressure until they control all of the apneas, and then they'll usually leave it there. Then once that's done, there are home care companies that will provide this equipment. Usually the insurance companies will cover it. And the home care company will usually come in and do all the education in regards to how the machine works. They may also fit you for a mask. They'll provide you a choice of masks, whatever fits you more comfortably. And there's a lot of equipment out there. There's several manufacturers, a leading manufacturer here in Pittsburgh that really has done a lot of work in this field. And so there's a lot of customizing so that you'll feel comfortable. I find, like Harry said, a lot of my patients, they just can't do without it.
That's great.
Some folks have a lot of problems with it. It takes a lot of work and adjusting with them, but we oftentimes get it there.
And earlier the one girl had said, that had called in, said, she's embarrassed to have to use one or tell her friends, and it's really surprising. It doesn't bother me that I tell people that I use a CPAP machine or anything. And it's surprising when you say that, how many people actually use one.
Or admit it.
Their father does, their uncle does, or their mom or whoever. It's not a real uncommon thing. I think it's a private thing for people.
Yes.
But I wish I would have done it long ago. My wife first was encouraging me to do so, and I just kept putting it off.
Okay.
And it was, it's definitely improved my sleep.
Well, let's take a call from Willa in Boalsburg. Hi, Willa. How are you?
I'm fine, thank you.
You have a question for us this evening?
Yes. First, I want to say congratulations to both Harry and his wife on getting a good night's sleep. And my question is, am I understanding it correctly that it's not normal to snore, and is snoring always associated with sleep apnea?
There is benign snoring where you may have some snoring that doesn't affect your sleep quality, doesn't necessarily result in apnea. So there is such a thing as benign snoring, and in that particular situation, there are things like mouthpieces that can be used to try to eliminate the snoring if it disturbs a bed partner. But If the snoring is associated with an apnea that a bed partner witnesses, it almost always indicates that there's obstructive sleep apnea. Now, you have to keep in mind that there's sort of a scale where you can go from benign snoring to snoring that disrupts sleep, which is called upper airway resistance syndrome, to mild to moderate to severe sleep apnea. So not all snoring is significant. But any snoring that results in arousals or obviously in apneas would have to be investigated.
Okay. Let's take a call from Nicole, or I'm sorry, from Janet in Johnstown. Hi, Janet. Is Janet there?
Hi.
Hi, Janet.
Hi.
How are you?
Fine, how are you?
I'm really good. Thanks for calling in. Do you have a question for us?
Yeah, I was just wondering, how is it possible to get cirrhosis of the liver when you never drank, never had no drugs or blood transfusions or anything?
Well, it's a little off topic.
Did you were asking about cirrhosis of the liver?
Yes, I was diagnosed with it, but I never had no drugs, no blood transfusions or anything.
Yeah. Well, Janet, your question is a good one, but our experts with us tonight are really talking about sleep and sleep problems. So would you be willing to call back when we have somebody that could talk about liver disease? Thanks. Okay, let's take a call from Nicole in Williamsport.
Hi. The problem that I have has actually been caused by my career. I have an advancing schedule, meaning I can never get up at the same time. It's always advancing clockwise. I get up during the day sometimes, I get up at night, and I can never hold a schedule. And now that I am in a new career, I'd like to have a permanent schedule. The only schedule I have found that I can stay on for any length of time is more of an overnight, evening, or third shift. And I don't know what to do to get back into a normal schedule because society doesn't seem to work with a night shift type of schedule. There isn't anything open. There isn't a lot of jobs, opportunities, and I just don't know what to do anymore.
Well, what hours are you sleeping?
Just whenever I'm ready to go to bed. If I'm not tired, I could take all of the over-the-counter medications there are, and I will not sleep.
Okay. Well, we usually don't recommend over-the-counter medications. So give me a rough estimate about what time do you fall asleep?
If I can hold a schedule, I'll fall asleep anywhere between 5 and 7 in the morning, and I'll get up roughly 3 to 4 in the afternoon.
Okay. So you have, again, a circadian rhythm problem, which the other gentleman called about, called delayed sleep phase disorder syndrome. And it's an extremely difficult problem to deal with. Actually, there are a couple of ways to do it. You would have to take several, probably about 2 weeks, and you could try going in both directions. Now, you could try to advance your bedtime by 15 or 20-minute intervals. Again, exposing yourself to bright light in the morning and dim light in the evening, avoiding caffeinated products, exercising on a regular basis, eating light before you go to bed, or you could try to move your clock forward so that you would have to delay your bedtime and delay your wake-up time until you fall into a normal pattern. But again, very difficult problem to deal with. And in your I'm sorry, go ahead.
I was going to say, I have, at different times, when, like if I have to be in a meeting, I can advance my schedule where I'm on a normal schedule, where I get up at 8 in the morning like everybody else, but I can't hold it. It'll only last for a couple weeks at best, and then I slip right back into the evening schedule.
Is it because you don't have a regular structure to your day? Mm-hmm. Is that why? Like you don't have a daytime job that you have to go to?
I think that's what it was, but I think over the years I've just naturally become more of a night owl. It's easier for me to hold an evening schedule than it is for me to get up like everybody else. I've always, even when I was a child in high school, I had a problem getting up early.
Because, the problem is not, it wasn't necessarily your work, but it was probably, this was an inherent problem that you had. And you will oftentimes see it start in the high school period, because high school around that age, most teenagers will have this problem where they stay up till 2 or 3 o'clock in the morning, they'll sleep till noon. And that usually tends to go away. But in some individuals like yourself, it remains a problem. And as I said before, you would probably be better off trying to advance through the clock, through the 24-hour period, by delaying your sleep period by 15 to 30 minutes for several days at a time, and delaying your wake-up period for 15 to 30 minutes for several days at a time, until you work yourself through the day and start your sleeping hours at the time you desire, be that 10 or 11 o'clock. And you have to stick with it meticulously. You can't actually ever break the routine. Once you break the routine, you're going to tend to fall back into your old pattern. And I said that before. It's a very difficult thing to keep.
Yeah.
Most people end up slipping back.
Okay. Well, Nicole, thanks very much. We're going to take a call from Karen in State College.
Hello?
Hello, Karen?
Yes.
Hi, how are you?
Good.
Good.
I'll tell you what, I'm trying not to be mean to my other half, who he makes noise when he sleeps, but I don't think you could call it really snoring because it's not loud. But he does at times not breathe, and he makes this whooshing kind of sound of air going that's very loud, or whistling, and sometimes I'll call it clicking. I'll just jab him in the ribs, as everybody else does, and just say, "You're clicking," and then he'll stop for a little bit, and it'll start right up. But it will cause me to go to another room. And I'm just wondering, is that serious, or if you're not making a lot of noise, is that not a problem?
It could be representative of sleep apnea. So that is he sleepy during the day?
Well, he does. I don't think so. I mean, during the day he's at work, so it's hard to say. It's hard to say, but I think normally he's okay. But boy, once he goes down, it starts up, and he never does this sound during the day. You never hear this.
It sounds like something that should be investigated. Is he falling asleep in the evening after he gets home from work?
Yeah, he usually does get tired.
And then if he hits the couch, is he out?
Yeah, but he tries not to get there because he knows
he's going to go out. Yeah.
Yeah.
Yeah. Is he overweight?
No, actually he's not. He's really thin.
Really? Well, you can see sleep apnea in thin patients.
Okay.
We oftentimes do see it in thin patients. But that's something you probably would want to speak to your physician about, because perhaps he should be studied.
Mm-hmm.
Okay.
Thanks a lot, Karen. Let's take a call from Lester in DuBois. Hi, Lester.
Hello, how are you?
I'm great.
I have a question for Dr. Illuzzi.
Okay.
In about 1985, I was diagnosed with sleep apnea, so I had a CPAP machine, and I used it for about 4 years, and my nose started bleeding, so I was told I needed the moisture. So I got this water apparatus connected, and that took care of the nosebleeds, and I did that for about 4 years, and all of a sudden I started getting ringing in my ears. And in the meantime, I went on to a diet and exercise and what have you. I lost about 40 pounds. Now it seems like I don't need the sleep apnea machine because I'm sleeping okay. But I still have this horrible ringing in my ears constantly. And I was just wondering if the CPAP machine had caused that, and if it did, is there something I can do about it?
I don't think the ringing in the ears is associated with the CPAP. That sounds to me more like a nerve problem. Have you ever had any testing done?
I was tested, and they said I had, I forgot the word they used, but they said I basically have to live with it.
Tinnitus is probably what they said.
Tinnitus, yeah.
Yeah, tinnitus. That's usually due to nerve injury. As opposed, it's unlikely that the CPAP caused the problem. And you probably should be retested, after the weight loss to make sure that the problem went away, because there are consequences to sleep apnea that's left untreated, and hypertension, diabetes, stroke, heart disease, all those things are associated with sleep apnea. So I would, despite the weight loss, we usually recommend a follow-up test.
Yeah. All right, let's take a call from Bob in Altoona. Hi, Bob.
Hi, how are you?
I'm terrific, thanks.
Good. I just recently went on the BiPAP machine, which, from what I understand, is a little bit different than the CPAP machine, and I can't tell you how much of a difference it's made in my life just over the last month and a half. However, the questions that I have pertain to the surgery. Now, I'm a younger male. I don't have the typical body type for someone with sleep apnea. And I really don't want to wear the mask for the rest of my life. I mean, it's not uncomfortable. I sleep great with it. But it is something that I would like to get rid of and have the surgery. I've been told that I'm a good candidate for the surgery. I was wondering how dangerous the surgery is it painful, and how much time I might need to plan to take off of work.
It depends on the surgery that's being proposed for you. There are several different things that are done. There's microwave techniques, which is something called somnoplasty, where they use microwave to essentially cook the tissue in the upper airway. Ultimately, it scars and shrinks. That's fairly painless. That can be done in an office. There is something called a uvulopalatal pharyngoplasty, which is a little more involved, where they actually cut out some of the tissue from the posterior pharynx. They may even do a reduction of the tongue. That's going to hurt probably for about 10 days. You'll probably not be able to eat very much for that period of time. It's actually a good way to start a diet. And you might be off work anywhere from 10 to 14 days. And then there's genitoglossal advancement, where the surgery is a little bit more involved, where it involves actually advancing the tongue in the upper airway. Sometimes they do that without small resection of the mandible or the jawbone. And then there's something as advanced as what's called the maxillomandibular osteotomy and advancement, where you're now talking about fracturing the jaw in two places and creating a surgical, what we call the Fort fracture, where the entire face is actually moved forward with the use of titanium rods, and that's going to probably involve several weeks off from work, and that's going to hurt somewhat. Again, I do surgery. We have some very competent surgeons who can do this type of intricate detail, and there's surgeons that are especially trained maxillofacial surgeons that are trained in doing surgery. But even in discussion with them, they do it if it's necessary and if patients have failed CPAP, and certainly for severe disease, and a lot of it depends on the severity of your disease. Surgery may be about 50% effective, maybe a little bit more depending on what you have done and the skill of the surgeon. I would advise, if you're doing well with BiPAP, then it's probably still the way to go.
Okay. Well, let's take a call from Ray in Winburn. Hi, Ray.
Hiya.
How are you tonight?
Oh, I'm coming along.
Do you have a quick question for us?
Yes. What is the difference between a CPAP and a BiPAP? I have a BiPAP, and I was wondering what the difference was. And I also have a full face mask that covers the mouth and the nose. In your opinion, how do you know which is best for a person, the nose or a full face?
Well, first of all, the difference between CPAP and BiPAP. CPAP stands for continuous positive airway pressure. So it is one pressure being pumped out by the unit continuously. BiPAP stands for bilevel positive airway pressure, where there is where there's a higher pressure when the person takes a breath in and a lower pressure when the person exhales. It's a matter of comfort. It really doesn't matter from a standpoint of treating the disease. There's no study that shows that BiPAP is really better than CPAP, but it's a matter of personal comfort. Now, the type of mask you wear, again, is an individual choice. Some people have nasal obstruction, where their nose really creates a high level of resistance, or they may be mouth breathers. And a full face mask may be what's more comfortable for you, and a lot of people really prefer a full face mask. Some people don't like a full face mask because it's too confining for them. So again, it's really an individual choice. If you're comfortable with that, fine. If you have difficulty breathing through your nose, we would recommend a full face mask or an oral mask, which is now available. So again, it's an individual choice.
Okay. Well, let's take a call from Randy in Brockport. Hi, Randy.
Hi. I have a question. I went into the sleep unit and I did the CPAP. And I got a real dry throat, whenever I was sleeping that night. And they said something about at home, if I got the machine, I would have like a humidifier or something. How does that work? Does it connect right to the machine? Or?
Yes, it connects right to the machine. Actually, we usually prescribe a humidifier for everybody. There are two types of humidifiers. There's something called a simple passover humidifier, and it looks like a tray that you fill with water in the machine. fits right on top of the tray, and the air passes over the water, adding humidity to it. And oftentimes now we go to what is called a heated humidifier, where there's actually an electric plate that heats the water and adds more moisture into the machine.
Okay. Thanks for calling in. Let's take our last call from Brandy in Reynoldsville. Brandy, can you ask us a real quick question?
Yeah, I was just wondering, at night when I go to sleep, I thrash around a lot, I talk in my sleep, and I snore really badly. And it's an every night thing. And I was just wondering if there was something I could do to help stop it or ease it.
Get a sleep study, because you probably have sleep apnea.
Okay.
The thrashing and the talking is common features that I see in patients with sleep apnea.
Thank you very much for calling. That's all the time we have tonight. I want to thank Dr. Angelo Illuzzi from Du Bois, and also I really, really want to thank you for all of your good, Harry, for all your comments. Thanks for all of your calls and comments. Tune in next month.
A copy of the program you've just seen can be purchased through Penn State Media Sales at mediasales.psu.edu or by calling 800-770-2111.